This conference will now be recorded.
Good afternoon, everybody, and welcome to the second day of June in our second June speaker series. We're here with James DiClemente, who is the director of the Center for Medics, where his primary responsibility is to design and implement all training and education for professional EMS employees, as well as the dozens outside the agencies. So there's many other different towns that have different agencies that will come in for training through James. James and his team has developed a unique program focusing on the benefits of simulation and paramedic program and continues to implement cutting edge technology within the program. In 2012, James was recognized with Educator of the Year, awarded by the Metropolitan Boston Emergency Medical Services Council. That's a mouthful. He's a member of the National Association of EMTs and National Association of EMT Educators. So without further ado, ladies and gentlemen, here's James. Thank you so much for coming in and doing this.
Yeah, no problem. Thanks, Chuck. I'm going to talk mainly about the role of EMS and paramedics and how I became a paramedic and what our day-to-day responsibilities are. As Chuck had mentioned, my primary duties here at Pro EMS now are really as an educator, but I think the entry-level path and the path people are most interested in typically is that of a field provider, EMT or paramedic. I started work here in 2008 as an EMT, became a paramedic in 2009 and have been here ever since. I'm an Eagle Scout as well. I got my Eagle Scout just about 20 years ago from Troop 425 in Medford. So, I've tried to stay connected to the Scouts where I can. I used to be our Explorer Post advisor here and have done some other, work with the Scouts. So like Chuck had said, I work for Professional Ambulance. We are the primary 911 transport operator here in the city of Cambridge. We also do work in Belmont and Watertown along with their rescues. And we do what's referred to as paramedic intercept work for 12 different communities out in the Concord area. And those are communities that have fire department based basic life support ambulances, and we provide them with paramedics and SUVs. So when we look at and there's my screen. So like I said, we operate both traditional transporting ambulances, and an ambulance is broken up into two different levels. We have basic life support, which is staffed by EMTs, and they're able to perform, as you would imagine, basic life support, trauma management, bandaging, CPR, as well as paramedics that have the same scope as EMTs, but also can give medications, can manage people's airways, and can provide a host of other interventions. So we have traditional transporting ambulances like you would expect. We also operate a series of these SUVs, which provide paramedic level intercept work, as I had mentioned, for towns that do BLS work. And, I've kind of broken this up into a few different components. So when you become an EMT and later on a paramedic, there's a huge skill set that you have to learn. There's a lot of equipment that we carry. Our ambulances, and you can see in the back of this SUV and this ambulance here, are stocked with equipment from devices that do CPR, which is what you're seeing, that Lucas device down in the corner, to trauma supplies and airway supplies and medications as our provider is going through here, as well as ballistic protection, all the protection we need for managing COVID patients in our Tyvek suits and respirators. And there's a lot of different components that we need to learn. Part of being on an ambulance is being able to respond to any situation. When you go to a hospital and you have a particular medical ailment, you'll go to a specific part of that hospital, be managed by specific physicians and nurses that deal with patients with your condition. The difference of being in an ambulance is we show up with the same unit to every call, whether it be a car accident or somebody having a heart attack or a baby being born. So we need to be prepared for all of those different things. Our job consists obviously of going out and helping people with a variety of ailments, but part of that job is just maintaining a state of readiness. So what you're seeing them do here is go through their equipment. We need to make sure all of our equipment is prepared. We need to make sure that we're training regularly. We do quite a bit of training day to day. So that's, like I said, my primary responsibility is doing training here for our providers. And that may include, what you're seeing here on the left is a joint training exercise we did with the state police, Cambridge Police, FBI, a variety of paramedic organizations in the area doing tactical medical training. We are doing self-defense training up here in the top right, and Unfortunately, in the nature of our job, we're dealing with, different environments in people's homes and patients with psychiatric disorders that may not want to come to the hospital with us. And, occasionally those become violent, and our providers need to train for that. To maintain that training, we do simulations. So what you're seeing in the bottom right there is what we refer to as a high fidelity patient simulator. So this mannequin, it blinks, it breathes, it moves, it talks, it does everything that a person can do. And the nice thing is any intervention that we can do on a real person, we can do on a mannequin. So before any of our field providers make it out into the street and treat real people, they've treated a mannequin like this hundreds and hundreds of times. They may not train doing CPR in a real person, but they've done it on a mannequin. So when they go out into the field and they see that first person that needs CPR done, they know how to do it. They know what it feels like. They know what equipment to use, and we're able to do all of that. Our training really starts at the EMT level. Even for those of us that are paramedics, we all have to start in our initial training at the EMT level. That course is a variety of lengths depending on where you take it, but it typically is a 3 to 4 month program. You'll complete that. You'll come out with a basic life support certification. We in Massachusetts and most places around the country are nationally certified providers that then get licensed by our state. And we can go out and work for an ambulance company as an EMT. As an EMT, you can get a job on an ambulance. It might be a BLS level ambulance. It may be an ALS level ambulance where you're working with a paramedic and assisting a paramedic. There are a variety of other jobs that you can get as an EMT. Many public venues will hire EMTs in order to work there. Your sporting arenas may hire EMTs out directly. You may find them in casinos and a variety of other places. But really, as an EMT, your primary job is going to be on the ambulance. If you like what you're doing, typically you'll work for a year or so as an EMT. You'll decide to go to paramedic school. Paramedic school will typically take you about a year to complete. It's an 1,100 to 1,400 hour course, where for the EMT program, it's mainly in the classroom. Half of our training is done in the hospital and in the ambulance as a paramedic. So we start off learning the skills, learning how to provide that treatment in the classroom. We'll go and spend several hundred hours in the hospital, going to the ER, going to the OR, going to obstetrics, all the different locations in the hospital. Once we finish that portion of the program, we'll go and we'll ride for a few hundred hours on an ambulance just to practice those skills with another paramedic who's precepting us and training us. Once you complete all that, then you become a paramedic. And once you become a paramedic, there are a lot of jobs that you can get outside of just the ambulance. I think most of us think about paramedics working primarily in the back of an ambulance, which is where most of us are going to be employed. But the helicopter services, so when people are really sick or really far away from a hospital, they may need to use a helicopter for transport. Those are typically staffed by paramedics, or a paramedic and a nurse, or a paramedic and a doctor. Excuse me. A lot of hospitals will hire paramedics to work as technicians inside the hospital. There's a variety of other jobs you can get. There's a pretty fast-moving component of EMS now, which is referred to as community paramedicine. So instead of waiting for somebody to call 911 and us to go to their home, we may proactively go to their home. If it's a patient that was recently left the hospital that had high blood pressure or has asthma and was in the hospital for that asthma, we may go and see them proactively just to see if they're doing better, or they're taking their medications, or they doing what the doctor told them to do, and actually try and prevent them from going to the hospital. The unique thing about us in EMS is we have the medical training, but we're also out there in the community every day. So we have that component already built for us to go and treat, manage people. So the skill set of a paramedic is pretty varied, and there's quite a bit that we may need to do from day to day in the ambulance, or from some of the other the other duties that we do. Aside from just local EMS, we will send ambulances out to disaster areas or other areas that might request those resources. So there's a picture here of one of our ambulances. We had 4 ambulances in New York. Actually, they just got back on Friday. They were there for the last 2 months in 2-week increments going out. This other picture is from a deployment we did to South Carolina during Hurricane Florence. So we were down in South Carolina for a couple of weeks. The EMS system, although it's kind of broken up and regionalized and broken up by town and city, it is also a big community. So we will respond all over the country, because if there's a disaster in one area, it's very difficult for you to just hire more EMTs and paramedics and find more ambulances. but there's hundreds of ambulances from around the country that can show up. So our ambulances were at the zoo here, at the Spartanburg Airport here for weeks with ambulances from all around the country and providers from all around the country. So that the work and the reason that a lot of people get into paramedic work is because of the ability to do so much. The question that always comes up is, how did you get into this? I actually was a lifeguard at Camp Nyhan in Saugus. I'm not even sure if it's still around, but I was a lifeguard there for a few years and just kind of liked the idea of helping people. I liked the medical training that I was receiving. I did my my lifeguard course with the Boy Scouts and just really kind of got into that and liked that. And knew when, you know, I went to college for communications, which couldn't be more different, but knew when I came out that this is the route that I wanted to take. So it was, you know, it was really the Scouts that kind of drove me to this. It's interesting now. So I'm the paramedic program director, and we have two of our, from the first group of Explorer Scouts that I had, two of those kids now are actually in my paramedic program. So, you know, I've known them now for years, but seeing that progression through and you know, obviously the Scouts kind of drove them to that. So it was that passion for the medical knowledge. It was that passion for helping people that kind of drove me towards the paramedic work. And for me, you know, it's given me a lot of opportunities to do things, to go places, to meet people that, you know, you wouldn't otherwise get. I think most people get into EMS and they go to EMT school thinking that it's just going to be, you know, flying around in an ambulance and helping people in fast-paced environment, and that's obviously part of it. But the piece that I think keeps people into it is you're driving around all day, just meeting new people, helping people, you know, interacting with families and in social situations that you can have a real impact. And there's not a lot of jobs where you have that diversity of interactions, but the ability to also impact people's lives on a daily basis. And, you know, for me, I couldn't imagine, you know, leaving EMS. I'm not on an ambulance every day like I used to be. I do more of the education, but you know, it's still that general drive that has kept me into it. So that's my presentation. What questions can I answer?
Well, first off, I mean, you've been well, you said so many things, so I'm sure there's still some questions left. But that's so great that you were a Scout. And I was going to say that so you know, we're in conjunction with the DCR, and we're opening Nyhan back up for Scouts to use. Yeah, so we're bringing it back. And then I was going to mention too, like me growing up in Scouts and being at camp all the time, it seemed all my friends who were also worked on the waterfront ended up going into EMS professions. Like some are paramedics, some are EMTs, some are firefighters. It just seemed like maybe that was the gateway drug, so to speak, is working as a lifeguard because of the excitement and helping others. Is there any other thing? Were you really kind of like looking to help? I know you said even with your communications degree, that's what you wanted to do, but was there any other aspect of EMS that made you really want to get into it?
You know, not really. I got into it like a lot of people did, a bit naive to what the job was. You know, I liked the idea and the concept of it, but you know, I didn't do a whole lot of research. I just thought, you know, this is just the route I'm going to take. I went to EMT school first, almost just jumping into it. Even working here in professional ambulance, I hadn't known of professional ambulance. My family is from Cambridge, and you know, they're in Cambridge, so I just kind of jumped in. And that's really true for a lot of people that I know in EMS, that they don't really know why. It's just, you know, this seems interesting, I'm going to try it out, and that's what kind of drove me to it. I see a couple of other questions here. So the differences in paramedics, EMTs, and EMS. So EMS, emergency medical services, is the profession that's the overarching kind of concept of what we do. So EMS describes, you know, different things. We're in ambulance service. The fire departments, they do EMS as well. You've got different levels of provider. There's actually 4 different levels of providers. There's emergency first responders. And they're going to be found typically in, you know, fire engines, and they're going to be found in non-transporting places where you just may need some very basic life-saving skills. You can do basic trauma management, basic, you know, CPR, things like that. Then you have EMT or emergency medical technician, advanced EMT, and paramedic. And it's The differences in them for us in the profession are very obvious, but I think they're sometimes difficult for us to describe. So what we usually, tell people is you've got your EMTs who are dealing really with the kind of outside of the body. They're bandaging you up, they're splinting you, they're providing CPR if they need to, some very basic medication administration. They can give, aspirin if you're having a heart attack, an EpiPen if you're having an allergic reaction. And can perform a basic assessment, vital signs. An advanced EMT has the same scope of practice as an EMT, plus they can give some additional medications, and they can put in some very basic types of breathing tubes. Once you get up to the paramedic level, we have about 50 different medications that we carry on the ambulance to treat cardiac disease, to treat diabetes, to treat asthma, lots of different conditions. We can use a full cardiac monitor like they can do in the hospital. So we do EKGs, 12-lead EKGs, continuous monitoring. We can draw labs, we can start IVs, we can put in breathing tubes. We can do a lot of those skills, use mechanical ventilators we carry in our ambulances. So there's a big scope. When we talk to people initially about being a paramedic, it's basically the first 30 minutes that you're in an emergency room, we can handle all of that stuff. Beyond that, we don't have x-ray machines or CT scans, so there's not a whole lot that we can do to help you. So those are the different levels. And then the difference between private and public ambulance services. So there is no difference really other than just the makeup. So in Massachusetts, most of the big communities use a private contractor to do their 911 transport. So in the city of Cambridge, professional ambulance, we've been here since 1969. We're a private entity that's contracted with the city to do ambulance work out where we do our paramedic intercept work. We're affiliated with the Emerson Hospital, but we're still the same kind of private entity there. So other than just the makeup of a service that's run by the city versus not run by the city, there's no difference in the services that we offer or the care that we give. What are the trends you're seeing this past with COVID? Do you think we've reached a plateau, and is that impacting how you're continuing to protect yourself? So I will say that we have no idea if we've reached the plateau. Nobody does. Right. We're in the hospitals a lot, so we see that kind of waxing and waning of the hospitals. And it's interesting because even at the beginning, or I should say even at the peak, the hospitals were never overwhelmed with people. They were overwhelmed with sick people. So the hospitals, the census may never have been 100%. They're not 100% full, but it's all sick people that are in there. And for us, we haven't yet changed what we're doing to protect ourselves. That's a good question, because that's something we have to consider. We are still maintaining the same level of diligence. We were just talking before you got on, but this is actually the first day that our paramedic students are allowed back in the building in a very limited capacity in very small groups, but at least we're moving forward there. But maintaining social distance, wearing masks, all of that. So what we did initially, and we continue to do, is now we're wearing masks all the time, every call, every patient, every time we leave our ambulances, we're wearing masks. We're continuing to do that. We're treating every person as if they may be a potential COVID patient, so we're limiting our exposure unless we have to. If they're able to walk, we're allowing them to walk to the ambulance rather than carry them as we normally would. And all of that we're continuing to maintain. We haven't changed any of that. There's been a lot of discussion about what is the precipitating factor that makes us say we're going to reduce what we're doing. I think some of it is going to be dictated by supply. I don't know that it's a surprise to anybody that it's very difficult for us to get new equipment. We, like many of the hospitals, are reusing equipment that 3 months ago we would have never imagined we would have to reuse. An N95, a surgical mask. We're now cleaning surgical masks at the there's a big truck in Somerville that will clean them for us. So all of that is continuing. At some point, we're not going to have the supplies we need, so we're going to make some adjustments there. But we haven't yet decided that we've reached the plateau where we can now scale back a little bit.
Now, you've done a lot of simulations, and you were mentioning that earlier. How lifelike are your simulations allowed to be? You showed us that mannequin that could do a lot of things that humans can do, but do you also put your students in situations, like you mentioned also like self-defense, but in terms of like maybe a fake car accident or maybe a fake burning building, something like that?
Oh yeah, no, we love to do that. Our instructors love to do that. So we all set up pretty elaborate scenarios here. Car accidents, we'll have multiple patients there. We actually have a big empty garage that we use for training that will set up, everything from, an explosion to an industrial accident in there with 20 people. Whatever we can do to make them realistic. We'll put in actors in the scenes that may act as a family member or, just a distressed person on scene. So there's lots of things that we'll try to incorporate in simulation. The mannequins do a great job, but it takes an instructor that understands how do they manipulate that environment to make it feel real. In our building here, we have 3 different sim labs that mimic different places we may find patients. So we have an apartment, we have a bedroom, we have a hospital area, an office space. So you feel like you're in that actual location. We have simulated medications, everything that we can do in order to try and make that feel like it's a real environment for them. We can never mimic the stress of a real scene, but we can try and push that stress as far as we can.
Great. I was reading up. You created a program called Halo. Could you tell us a little bit about that?
Yeah, so one of the things with a lot of the skills that we perform, as a paramedic, there's a book full of things that we can do, but many of them we never have to do, or we have to do very rarely. It's one of those, there are certain skills where it's not needed all that often, but if we don't know how to do it, there's no other hope for that patient. And the problem is we don't perform them often enough. So in many services, you go into paramedic school, you learn how to perform a skill, and then you come out and there's no real way to ensure that you're continuing to maintain that level of training. So then when it comes to do it, you freeze up and you forget how to do that. So we developed Halo high acuity, low occurrence training, where we take all of those skills that are very important, but not always used. And we have a very specific way that we teach them. We use checklists to go through them and making sure that we know exactly how to do it. So we train that now every quarter. So when you go out and you have to do that in the field, it's second nature like any of our other skills because we're doing it so frequently. It's a very simple and seems like a very obvious thing, but it's, people oftentimes focus on the stuff that we do every day. They're making sure that we can, start IVs, medications, things that we're doing every day, but not the things that are a lot more rare for us to do. This is a good question too. We get asked this a bunch about specialties in EMS. If you had asked me that question 5 years ago, the answer is no. Today, the answer is not really, but we're moving in that direction. So we now have specialty certifications for flight paramedics, for community paramedics, for tactical paramedics, and we're moving in that direction where you can, not in the same way that a physician might specialize in something where they're doing a fellowship or residency in a specific part, but we're starting to see that develop. There's some great local programs that are doing it. Nationally, there's a national certification group for it, but that's kind of the movement that we're heading towards in EMS, that we're doing so much more now as paramedics than we were doing, even 10 years ago when I started. The whole concept of community paramedics, or it just wasn't really a thing that we considered. So the answer now is not really, but we're starting to move in that direction.
And another question: the paramedics or the EMTs, who do they volunteer when they go to those disaster areas with the ambulances? And you said it's like 2 weeks at a pop. So who gets to make those decisions, or do the companies themselves volunteer to provide services?
Yeah, so it is. They're not volunteered. We're employees. The system itself is actually funded through FEMA, and it's a pretty complex system that's managed all across the country. So there's a single entity which manages all of these FEMA deployments, and they maintain all of the equipment and the resources. And then as a company, we have to provide certain training to our people. We have to maintain certain standards for ambulances. And as long as you qualify to provide ambulance services for other areas, then we're basically put on to a list where we get called up depending on the location. And there's a variety of factors that they use. So before we actually went to New York, we did it is still technically a deployment for FEMA, but it was done at Logan Airport, just doing monitoring for people coming off. So we had 40 people that we were managing just to do screenings of people coming from other countries through the airport. And then for that, essentially, you're just put onto a FEMA list. Generally, what they do is they pull from other parts of the country. That's why most of our deployments have been a lot further away than New York, because they try not to deplete the local resources. They try to call people from other parts of the country. But in this case, because it was so hyper localized to New York and there wasn't much fear of surrounding areas needing it, they pulled a lot of Boston resources up into that area. But still, those were, again, companies from across the country.
Do you have or do you still have, or do you talk to a mentor? Have you used a mentor before? Do you mentor yourself? It seems like there's a ton of kids who go through. And just as an example you gave earlier, your Explorer Scouts.
Yeah, so it's interesting, and my mentor here, especially as I started to grow in the management side, has been our CEO Bill Mergendahl, who's been pretty involved with the Scouts and working with them, and as children in the Scouts, and just kind of building us up. And he's always kind of taken that role here, where he is very engaged with us on a day-to-day basis in order to continue to grow. And then just some of the physicians that I've met throughout the way, and some paramedic friends that I've met that have now gone off to medical school or flight services or PA school. Those are all folks that I have pulled from, especially the ones that I did my initial training with as a paramedic, where I really trusted and knew that these were people that I could always pull information from. And it's interesting for us, and it's true for anybody in medicine, but the science is always growing so quickly that you don't just learn a set of facts and then you're done. We have to continue to learn every single day. We're training, every day we have something that we're doing, whether it be continuing education training or practical training or a new piece of equipment or a new skill. We're training on a very regular basis to make sure that we're always ready. And even as the educator, I still need to make sure that I'm getting that information from somebody.
Great. We're coming up on our time, but we have another question. Do you folks also provide Medi-Flight too, or is it just ambulance, your company in particular?
No, just ambulance services. So there's only 2 flight services in Massachusetts. One of them is Boston Med-Flight, who does both ground ambulance work, helicopter work, and actually they do fixed wing airplane work. And then there's UMass operates a single helicopter out in the Worcester area. But New England is unique in the way that the flight programs are done, where around the country it's a lot more competitive. There's a lot more services. All of New England has actually created a pact together to make sure that you don't have that same level of competition and the same number of air ambulances. And you see on the news, unfortunately, very regularly that there's crashes and fatal crashes. So in order to prevent that and keep the safety standards up, they've limited the number of providers in.
That's great. Do you have any words of wisdom or advice that you would give to any of the younger Scouts or anybody in the audience today in terms of maybe following your career path, or just in general how to be a good, safe human being?
Yeah, I mean, for EMS, I think it's a great job opportunity, but it's not for everybody. And I think a lot of people jump into the profession just thinking like, oh, this is going to be so cool. It is, but there's a lot that goes into it. There's a lot you have to do. But the nice thing is it's pretty easy to get job exposure in EMS. Most ambulance companies will allow you to do ride-alongs as long as you're 18. So if it's something where you get a little bit older and you think this might be something I'm interested in, I always tell people, go do a couple of ride-alongs with a couple of different services before you actually make the leap, because it's a great job, but it's not for everybody. But for those of you that are considering it, I say absolutely you should give it a shot. It's a terrific job. It's a terrific opportunity. It's a great way to just stay engaged with the community, feel like you're doing good every day that you get out of bed, but also a job where there's a lot of opportunity for growth and change.
Well, thank you very much, James. This has been a real pleasure, and we thank you. And hopefully maybe once we get going, I mean, we were so excited to take part in kind of bringing scouting back to Nyhan, and then we can't. So, but when it's open and going, we'll have to look you up. Thanks.
All right, great. Thank you.
Thank you very much. Have a good one.
Bye.